I'm going to talk a few minutes today about a tough decision that we all unfortunately have to make so many times with our pets, and that's basically an end-of-life decision. About 90% plus of all of our pets and our animals that we have, that we live with, have to be humanely euthanized when the time comes. Trying to make that decision and how that is done is very, very important to our pets and to us. The criteria that I primarily use for making that decision is that I want to make sure that animals are not hurting. If I can't take them out of pain, then that is a major issue. Can they eat? Their ability to eat and sustain themselves is extremely important. And also that goes along with that is, can they drink? Are they able to drink and maintain their normal hydration? The other things that we consider that an animal's well-being is are they still part of the household? Are they part of the family? How do they respond? I don't mean that we get out in the backyard and have a 16-year-old dog and we play ball again, but do they respond to us as we come in a room, and are they glad to see us as we are glad to see them? And then the other considerations we have is incontinence. Are they having issues when they eliminate? Are they urinating on themselves? Are they having bowel movements on themselves? And those are not just a health issue. Those are a matter, believe it or not, in the psychology of being that individual, that dog or that cat, that pet. And that's extremely important to them, and they do get upset when they know that they cannot maintain their normal elimination behavior. The last thing is that I use as a criteria for making a decision is we have a very dangerous animal that we can't control, and there's a risk of life or injury to someone here in the family or in the neighborhood. But most of us have to make our decisions based on health, and that's what I've had to do my own animals in that manner. And sometimes it's very difficult to make that decision. Regular veterinarians in many clinics make that decision every day along with their staff, and that decision has to be in conjunction with the owner's understanding that this is the right thing to do, and it has to be the right time. How this is performed in any clinic, it may differ, but the standard of what we do here is we talk with everybody and make sure that what we're seeing and what's happening with our pets, it really is the right decision for them at that time. Once that decision is made, there are obviously, unfortunately, we have to make legal signatures so that everybody understands that this is what we're doing and why we are doing it. What I do is, and so many other of my colleagues do, is we give them a light sedative, something to calm the dog or cat, and so many other animals too. We have also had to do this with small pocket pets and birds and a whole number of animals to humanely take them out of their suffering. But the sedative relaxes them enough where they settle down into a quiet environment. It also gives people a time to think about it and see their pet in a quiet and safe manner. At that point in time, when everybody understands that we've said our goodbyes, we use an overdose of anesthesia. This is a medication that is manufactured and designed for humane euthanasia. And in essence, it's an overdose of anesthesia, and all body function usually ceases within 30 minutes. There's a process that goes on after that. Decisions have to be made of whether they are to return home, to be buried at home. Many of my animals are buried at my house. Cremation is another choice that is made by many people, and the ashes may be returned, or they may be put in a mass grave. Regardless of how you look at it, this is a very hard subject and a very, very difficult decision, but it is an appropriate decision and a fair decision for our dogs and cats. And it is normal to grieve the loss of our pets. They're part of our family, they're an integral part of seeing our kids grow up, and they're also companions as we get older, sometimes the closest friend that we have. For that very reason, then we should give them the right of a humane euthanasia and not to suffer.